And yeah, just to be clear, the whole tenant committee has asked that we read this statement on their behalf. So as you can see, the Rebecca Towers is a 17-story, 165-unit high-rise building. The most recent reports from the city confirmed there have been 67 COVID cases and 1 death in the building. Paramedics did door-to-door testing yesterday, and they've returned to do more testing today. Results of the test should be known within 24 hours. And we suspect the total case count will be very high. The landlord and the city say the outbreak is due to tenant socializing and negligence, and we reject this claim. The city staff say they did an investigation of the building, but the city didn't even know that 1 elevator has been out of operation since January. This obviously creates a lot of issues with social distancing in the building. The city didn't even bother to talk to the tenants and ask us what is going on. They just took the landlord's word for it. This is very disrespectful. In fact, the majority of people who live in the building take COVID very seriously. We have to. We are working class people. Most of us work in frontline jobs. We live in close quarters in this building, and we use public transit. It is a very scary time. And so we take every precaution we can to keep ourselves and our loved ones safe. Tenants had an emergency tenant meeting on Wednesday evening by video conference, and together we identified what we think are the major reasons for the outbreak. First and foremost, Medallion's decision to shut down a functioning elevator during a pandemic for renovations, largely cosmetic in nature, we believe, leaving us with 1 elevator for a 17-story building with hundreds of residents. Number 2, the city's failure to communicate about the outbreak, despite knowing about it since March. Number 3, insufficient levels of cleaning staff and security staff by Medallion. Number 4, poor ventilation systems in the building. Number 5, Medallion's inaction as cases were spreading through the building. And finally, some tenants' individual lack of respect for other vulnerable tenants' health. While many of us wear masks and follow social distancing protocols, some people do not. This crisis has shown the need for tenants to do better and keep each other safe.